Dr. Thirion here, and if you're watching this video, it's likely that we just talked about cataracts during your eye exam. So this short video is going to be there to reinforce what we discussed and to talk about how we manage cataracts over time. So we have a lens inside our eye, kind of like a lens inside a camera, and it can get kind of dirty. And I think it's like a dirty car windshield, and that's basically what we call a cataract. So the way we get cataracts is by UV exposure, smoke exposure, and I'm not just talking cigarette smoke, I'm talking grass, wood from the chimney, from the grill, any kind of smoke. And so those cataracts progress over time with more exposure. So the way I think of it is basically like snow falling on a mountain and that snowball rolling down that mountain. And so when we're young, not really a whole lot of snow on the mountain, but that snowball is starting to roll down it. As we get older, more of those exposures happen, and that snowball is picking up more and more steam. The average American has cataract surgery around 68. And so what I do is I look with my microscope and I just keep an eye on where I think that cataract is on a scale of 0 to 4. Now, every eye doctor runs their scale a little bit differently, but the way I kind of do mine is 0, no cataracts, 1, you have some, but cataract surgery is probably 10, 15 years down the road, maybe a little bit longer. 2, they're there, cataract surgery is probably 10 to 5 years away. 3, you have them, they're pretty close to being ready for surgery, if not ready for surgery. And then 4, definitely ready for surgery, getting us rocking and rolling. And so things you can do to try to slow down the progression of those cataracts, you can, wear sunglasses, which I highly recommend. You can stay out of smoky environments, which again, I highly recommend. And so doing those things will slow down the progression of those cataracts, but it won't stop it entirely because again, there's already snow that's fallen on that mountain. And so every year I'll look at those cataracts with my microscope, see if they're changing at all, give you an idea of kind of where I've got those pegged and what I think we'll need from surgery standpoint. But things can change. I don't have a perfect crystal ball on my timing on all that kind of stuff. And so when it comes to the cataract surgery, it's pretty simple, pretty easy procedure. It takes about 4.5, 5 minutes per eye. They'll do one eye and then about a week later they do the other eye. It's one of the most common performed surgeries in the US. And they'll offer you 3 different options when it comes to the cataract surgery. One is the basic package. That's the one insurance will help out with, but you'll still end up a lot of times needing glasses off in the distance, glasses are closed. It'll be similar to what you have right now, your need for glasses. You can do what they call their intermediate package. It costs a decent amount of money in my opinion, but you can do that procedure. It'll set you up where you don't need glasses off the distance, do up close, or if you've been wearing contacts and familiar with monovision, one eye for distance, one eye for up close, they can do that as well. The third package they'll offer is what they call their premium. They'll put a multifocal lens in there so you can see distance, you can see computer, you can see up close. Don't really need glasses anymore. Occasionally you'll have to pick up task glasses, if you're trying to thread a needle, tie a fishing hook, read a medicine bottle. Sometimes you'll have to pick up glasses there. But cataracts are nothing to get too stressed out about. We'll just keep an eye on them and slowly watch them progress over time until it's time for surgery. Understand that this video doesn't replace your exam or your need for an eye exam. It just reinforces again what we discussed and how we kind of manage what's going on from a cataract standpoint. And so if you have any questions, we're always here to talk more.